Good afternoon, everybody. Today is September 10th, 2021. My name is Scott McGann with the Falmouth Health Department, doing our weekly COVID-19 update for the town of Falmouth. Our website is falmouthma.gov. I'll put the updated information on it as far as where we are with cases and so forth, and this presentation also goes on it. Health@falmouthma.gov is our website, and our email and our website is 508-495-7485. So as of this week, there's 1,811 cases. There's been 65 for the week, so we are definitely up from on the last 2 weeks. And 11 probables. I think we were 57 and 18, so a roughly similar number to last week when you add both confirmed and probable. About 95% are no longer in isolation. That number would go down the more recent cases you get. Our daily incidence rate jumped from 12 per 100,000 to 20.6 per 100,000 per day. And since we have about 32,000 people in town, that equates to roughly around 7 cases per day. So 7 to 8 cases a day, give or take, is that 2-week incidence rate sticks into the last couple weeks. So the number the state gives us is 20.6, which is roughly around 8 cases or so a day. 8 times 7 is 56. So it's somewhere in the ballpark of where for confirmed cases. This is the state's data. It takes the 2 previous weeks, so it takes in the week that we had less cases, so it's slightly lower than what we maybe have seen in the last 7 days, which would be a slightly higher number than 20. Our percent positivity jumped from 2.44 to 3.67. More people are getting tested, and we are finding more cases. The positivity hasn't jumped up as well. It's jumped up a whole point. It's still well under 5, but for us, I think 3.67 is a bit on the high side for us, and of course, our incident rate as well is high for the last 2 weeks. There's been a couple of clusters associated to it. So of those 100, let's say in the last 2 weeks, there's been about 120 or 120 cases. 10% might go to a cluster, and there's been a lot of transfer among households. So 1 in the house becomes 3 or 4 in the house. That's been very common in the last couple weeks. And again, also some clusters associated with different things. And so that plus a fair amount of community spread, we're at that right around 57 and 65, so plus or minus 60 when we had 5 straight weeks of 20. That is something that we definitely need to keep an eye on. This is a chart that shows the flatter the line, the more horizontal the line, the better we're doing. You can see the last couple of weeks we start on that high incline. Hopefully we can flatten that out. You can see a similar sort of pattern that maybe we saw in January, hopefully not quite as severe. But again, the flatter the line, the better. You can see where we've had that December to March, December of this past December to March of this year into April, the highest sort of weeks that we've had. I'd like to see, hopefully we can get that back down to a flat line. Similar happening in the county. The county's got a higher 3-day average as well. Over the, since Delta in the mid-July, it's sort of got a little bit better in around August and sort of ticked back up in this sort of a wave, a peak and valley with what's been going on. We were doing pretty well with the 20. I think we were lower than the average. Now we're sort of in the middle, and I'll show you that in a second. Hospitalizations, at least in Falmouth, have been pretty good. 4 and 1. The week before was 3 and 0. 4 and 0 the week before that. 3 and 0. 1 and 1. So you don't see a huge jump in that at this point. The vaccines do work. They do help you in terms of hospitalizations and deaths. I have a slide on that later. You do see an increase a little bit more at Cape Cod Hospital, where they're at 11, where they had been consistently between, looks like 7 and 8 for 3 weeks. The state had 2,000 cases. They were in the teens, the 1,500 plus or minus. Their positivity hasn't moved much from around 2.5. A lot more tests are being done. You also see a lot of healthcare institutions starting to implement weekly tests. That'll drive up the number of tests. So even though there's been an increase in cases, the positivity stayed because either the individuals are getting more tested more rapidly, plus, some of the healthcare businesses are also healthcare entities are also jumped into, increasing more routine testing. There were 18 deaths on this particular day. Looking at where we are chart-wise, you can see the increase, obviously, in cases. Positivity's been relatively flat recently. Hospitalizations have gone up the last week or so. They look a little flat. Deaths have not jumped up with hospitalizations at this point, primarily because, as again, I have another slide to show you, that the vaccine works really well at the hospitalizations and deaths. All these numbers are up. This is the 14-day incidence rates for the Cape Towns. You can see that we're at 20.6. Usually we're in the middle to the lower side of incidence rates. So, you know, over the last week or so, we've had quite a few cases that's driven us to 1, 2, 3, 4, 5, fifth place in the wrong way, the fifth highest. We're usually, you know, bottom third to a bottom half for incidence rates throughout the pandemic for the most part. But you can see, all you take from this chart is that the Mid-Cape and Upper Cape have had an increase in cases. And so that's where we are with that. And percent positivity, we're on the slightly higher side of the mean. And normally, you know, we're right at it or so for the most part. So again, increasing cases, a couple clusters have helped drive that up. And in addition to that, just more cases, more cases, more cases. As far as vaccines go, still right around 72% of eligible residents throughout the county. In Falmouth, we're almost 80, 79, lower left-hand corner, 79.6 of all eligible residents are fully vaccinated. That's a pretty high, very high number. 87% of the residents have received at least one dose. We've been averaging, like last week we had a little over 300 doses administered during that 7-day period, adding both first doses and people finishing the series and having their second dose. This week it was 208 doses administered. So we've had made smaller gains over the last week, but we still have been averaging right around the 200 roughly, give or take. So vaccination rates, again, have been high for a while. Falmouth's had a great uptake in vaccinations. We still have approximately 2 out of 10 eligible people that still need to be, you know, are still choosing not to, or for whatever reason, and so they're not vaccinated. But by and large, that is definitely higher than any average you'll find just about anywhere. Same true with the Cape in general. So I had referred to this before. This is from the state's weekly cases among fully vaccinated individuals. So as of 9/4, there were 23,858 breakthrough cases. These are people fully vaccinated had cases, which represents 0.53% of all vaccinated people. Okay, so vaccine breakthrough definitely occurs. It occurs in Falmouth. It's occurring everywhere. There's definitely plenty of vaccine breakthrough. But the good thing to take from it is hospitalizations among cases was 762, which is 3.9% of the 23,000. And the deaths among it are 0.68, or somewhere around 6, nearly 7 per 1,000 of cases. And that's getting lower towards more what you would see during a bad flu season, as opposed to what we would have seen, the 3-4% death rate among cases when we weren't vaccinated. So you definitely see these numbers, just looking at the state's numbers, saying that deaths and hospitalizations are at a lower rate than they would have been without the vaccine, which I think we all know that, but this is the data from the state, and I just added the percentages in to show that vaccines are effective in hospitalizations and deaths. They're effective in cases. They're definitely a benefit to having it. It does definitely lower the number of cases. If we had no vaccine right now, we'd have a lot higher cases than the 65 we've had, I have no doubt. But essentially, there is quite a few vaccine breakthroughs since Delta has come on the scene. As far as vaccinations, you still go on the VaxFinder, mass.gov. Your pharmacies are still doing it. The Barnstable County Health Office does it once a week. Convenient MD does it as well. They do have some. The last time I've checked with them. Community Health Center of Cape Cod. If you're truly homebound, again, call the Falmouth Health Department. We'll work with the VNA to get some doses for homebound individuals. More information, we'll talk about third doses in a second, but that's where we are right now. And we'll eventually start, as the third dose game plan comes down from the state, we'll, at the town and the Barnstable County, will have more clinics, kind of what we do before. You're not going to see, I don't think you're going to see mass vaccination centers per se, so that's going to leave it more on us and the pharmacies to take care of it. Don't know exactly how that's going to roll out. Obviously, we'll do this on our update, and I'll update as I get more information. In terms of testing, there's been a high demand on testing. Convenient MD and CVS do a lot of our testing. I have heard that there's been some difficulty of getting it, or a little bit delay of getting an appointment. You can also, if you're symptomatic, go through Falmouth Hospital through your physician or the Community Health Center of Cape Cod. Fairgrounds right now is doing testing on Sunday and Thursday, and we're working maybe to increase that depending on where we are with testing. But there is testing available. There's also home kits. However, if you do a home kit and you don't, it's really hard for that to make it into the system. We're not necessarily going to know the home kits. I think there's a way of logging it in, but the state, if you become positive on a home kit, you should be obtaining a PCR test from one of these outfits, one of these entities. That's the way we're going to know to contact trace it. If you take the test and do nothing with it, we're not going to know it. It's not going to be a Maven system. It's not going to be in the system logged in as a case. So they're not bad to have, but you are seeing a run. You do see people. I do know people are taking the home test. In terms of third dose, so right now, if you have moderate to severe immune compromise, from a disease you may have, or your condition, or medications, talk to your physician. Get yourself a third dose if you're interested. It has to be at least 28 days from your first series of Moderna or BioNTech, so after your last dose. There's nothing right now for third dose based on age. There's just based on your immune system, essentially. There's nothing saying that, okay, 75-year-old and older, come down now to get your third dose if you want it. There's none of that information right now as of this. If there is, I'll message that out as well. But right now, it's not age-related, it's immune system-related. If you're immune compromised, and, you can talk to your primary, and then you can get yourself a third dose. I did look at one of the websites, I think it was CVS's, that did ask that question, and so there is a mechanism for getting that third dose, but it's only limited right now to people that are immune compromised. Okay. Again, talk to your healthcare provider. And again, once we know more information exactly how to roll, we can do clinics. It's not a problem. It's just who's getting the doses, who's the state want to have the doses, how's the state want the vaccines to be distributed. Still waiting for details on that. Face coverings and other mitigation. Again, Falmouth has a mask advisory. We advise everybody to wear the masks. I happen to notice out and about that about 2/3, roughly or so, I'm seeing in most places. State has wants you to wear a mask if you're unvaccinated or vaccinated with a weakened immune system, and then public transportation. That has not changed. The CDC recommends unvaccinated also. A vaccinated should wear masks in areas of substantial or high transmission, which I'll talk about in a second. Also looking at your healthcare capacity and vaccination rates. And the state did require this week for us, to start the school year fully masked on indoor activities. So we're looking at the CDC's metric. I have that orange line in the middle. They're saying in areas of substantial or high transmission. Right now our numbers are moderate. Last week and then this week, of course, with an increase of 7.8 per 100,000 daily incidence rate up to 20, that we're in the middle of the moderate level of incidence. Percent positivity, we still remain in the low category. So 50 per 100,000 would be somewhere around 16 daily cases, and 115 or so cases per week would put us in the substantial. This is an item that we talk at our Board of Health meetings. We meet every other week. The board may, do other things as a discussion item. They may want to have an agenda item if they choose to go to a mask mandate or not. Right now, the line in the sand is whether you go from up to substantial amounts of transmission. We're not at that yet. You also need to look at your healthcare system. Right now, a healthcare system, we've been pretty consistent in, even when we were low in the pandemic, you'd still see 1 or 2, 4 or 5, that's one thing, but we're not necessarily being indication of, a real big increase in hospitalizations. Again, we all got vaccinated. I showed you a couple previous slides that the vaccination rates are doing really well to prevent hospitalizations. That was a very low rate compared to what COVID was without the vaccine, and that was not Delta, that was the original version of COVID. And so, I think that's a good indicator that, Yes, there's transmission. Yes, there's breakthrough, but we're not ending up in the hospital at a rate that is unattainable at the hospital level. And the CDC wants you to look at vaccination rates, and we're always going to have an A on that because we've always done really well with that. Again, 80% of eligible residents are fully vaccinated. That's a real good number. So we're meeting 2 out of 3. We're meeting 3 out of the 3. It's just, we need to keep an eye on the indicators. That I'll present this to the Board of Health every time we have a meeting, every couple of weeks. Monday will be the next one. And, we'll have to keep monitoring the cases and whether we need to do other kinds of mitigation, like, whether a mask mandate would be considered or not. I don't want to have to do it, and I don't think the board does either. And, that's what we have to look. This is what the CDC wants us to look at. On the state has no particular, doesn't have any direct guidance on it. There's no magic number that tells you need to flip the switch at something. So we've used the CDC, and that's the switch is where I put that orange line, is when we get to substantial transmission. So you're talking about 115 cases and 10% positivity, 8% positivity is a high number. I don't know whether we get to that. We don't normally have tested that high in the past, even when we had a lot of cases at a percent, because we do a lot of testing in this town. We have a lot of access to tests with the different entities we have here, although, there's been a little bit of a bottleneck. And also, we also have a lot of health care here. We have the hospital here. We have, a lot of long-term care that do a lot of testing that drives up the number of tests. Therefore, the positivity doesn't necessarily get as high as, maybe some other towns that don't have as much health care as we do. So as a recap, our case count jumped the last 2 weeks. So instead of being in that 20 to 30 range, we're in around 60 range. Our incidence rate's going to jump as a result. We're up in the moderate level. Sustained increase if we continue on this trend, and we continue on an upward swing. The Board of Health may need to consider that. That'll be up to them. Vaccine eligible. We're about 80% vaccinated among eligible people. We're averaging a couple hundred vaccines per week. Like to see us get higher. I don't know how much higher we can get. I haven't seen a lot of locations where we get much higher than 80%. I'm sure there are some. I just haven't seen any. Third doses are recommended for the immune compromised, not age-based. It's immune system-based. As an individual who's been vaccinated, I'm telling you the vaccine breakthrough does occur. However, the vaccines, the disease itself is definitely not manifesting as severe than those that have been vaccinated. I'm sure you've heard that plenty on the news outlets. So vaccine is still very effective on the hospitalizations and the deaths. Just with Delta, not as much with breakthrough cases. So take that grade of, that's where we are with that. So as far as my update, that's it for the week. We'll do another one every week. We'll have one on Friday. And I'll talk to everybody. See everybody then. Thanks.